My name's David Sallman from Moffitt Cancer Center in Tampa, Florida, and again at the ASH 2023 Congress. I'm part of a very large group called Validate, which is a multi-country and international consortium where we are looking at very big and central questions in the management of MDS patients and trying to truly identify and validate, for example, response criteria, outcomes in certain patient populations to really give us the best historical subset when we're looking at new therapies and are we doing better or are we not doing better than historical. I think when we have really small cohorts, this can be actually very challenging and you get sometimes controversial or conflicting data. And so one thing that I'd like to highlight is when we think about what response we're trying to achieve in patients, we don't just want blast clearance. This is called a marrow complete remission, and we've actually eliminated that from the response criteria. But what we really want to see is either true complete remissions where all blood counts are really back to a more normal range, or at least blast clearance with some level of hematopoietic recovery. And thus there are what we call composite complete remissions, where we look at both true complete remission as well as true complete remission with some other, again, sort of in-between response. We can call this CRH or CRL. And what we really nicely show is patients that achieve that response have really identical outcomes to patients with true complete remission and much better outcomes than patients with any other response. So I think when we go forward and, hey, what is really exciting in any area of MDS, particularly I would say in the high-risk setting, if we can achieve, again, complete remission or, again, a marrow response where we get blood count improvement, again, what we call CRH or CRL, then that is really what will be most meaningful. And then that, based on those data, if those data are exciting, again, versus historical data, potentially would best support what trials should next go into the pivotal phase. And I expect to see a lot more data coming out of this consortium. There was actually 6 abstracts at this Congress looking at different things, but that is just highlighting one of sort of a key question that I think was answered at this Congress.